Okay, thank you.
Thank you, Dean, for the nice introduction. And I'm Effy. I'm one of the board visitor member and also early entry PhD option student and graduating this August. So I chose this is my campaign message, Together Happier. The reason I chose this title is because I really sense there's a synergy with working together with the community and working with different stakeholders. So that's why I chose this title. And the other reason is that improving mental health and lives of vulnerable populations through engagement and empowerment is the cornerstone of my research career. So with that, I'm going to start my presentation. And I did receive a feedback from my colleague that when I do my presentation, I look way too serious. So I take that very seriously. And I'm going to use this slide to humanize myself a little bit. So you can see in the right corner, it's a 6-year-old Effy being really rebellious, and she's trying to escape her photo duty and trying to get away from her mom. And the nature respond to my call really fast. So on the left, you see it's a photo of me and Mom in a float about to take on a venture further out in the sea. And when that happened, the wave took me away, and I had a near-death experience drowning in the sea. So it was actually one of the most amazing experiences I've ever had in my life. And since then, I've been really fascinated about human brain and how this object made of 80% water make us feel, think, and do things. And so that's me when I growing up, and I grew up in China until high school, and then I come here, become an undergrad student. So people always ask me why Wisconsin, and I used to tell a very long story how I got here. But so with the time being, I'm going to tell you a shorter story. So in this photo, you see it's a 9-year-old Effy got kicked out from her dorm because she stood up to the dorm teacher not allowing students to drink milk. Which is ridiculous, and that's what I thought, and that's what my parents thought, and my parents was proud of what I did, and they took a photo of me and said, "You just soldier on." So I think it's really meant to be for me to getting my degree in a land of dairy. Yeah. So now I've proved myself I'm not a robot. I'm going to talk about my trajectory, how I got here, and what I'm researching on. And to drag you all over the globe and across the lifespan, so please stick with me. I'll eventually get back to Madison. So as I said earlier, I'm an early entry PhD student. That means I finished my undergrad degree here, and then I go straight to PhD. So when I was undergrad, I also participated in the honors program where I worked with my mentor, and then we conducted a study on to explore a relationship between nursing home length of stay and the nursing home residents' adjustment of their life. So what we have found is that people who stayed more than 1 year had the best adjustment, followed by people who stayed under 3 months, and residents who stayed 3 months or more but under 1 year. So with this study, I received the Honor Thesis Award from the Charles Akbar Foundation, and with support from the Region-funded scholarship program, I was able to present the study findings to regional and national conferences. So then when I graduated from my undergrad program, I started my graduate level training. So early on in my doctoral study, my research focuses on the health of marriage migrants, or you can call it the new mail-ordered brides, which is a growing phenomenon in Asian countries because some of the demographic and social changes. And I also got a certificate from the ICTR on clinical and community outcome research. So with that training, I spent one summer in Singapore working with various community stakeholders, including those serving migrants, women, and low-income communities. This effort was to gain access and to this vulnerable and hard-to-reach population, and also to have a better understanding of the needs of this community. So when I was there, I also worked with some of the local scholars, and we conducted a literature review on the health needs of this population. What I have found, and also through talking with marriage migrant while I was in Singapore, is that this population is really vulnerable to psychological distress and mental illness, especially during their postpartum period. I also wanted to highlight that during this period of my study, my program was supported by the James and Susan Patterson Nursing Graduate Student Fellowship Fund, and with support from the School of Nursing, I also was able to travel to present my study findings. And there's a picture of the dean and with Susan Patterson. After coming back to U.S., I discovered a population are kind of similar to marriage migrants in Singapore. So these are women of graduate student, international graduate student, or immigrant workers. So they're on a dependent visa. So they're kind of in a similar situation as those women staying in Singapore. But at the time, I don't quite know what this group of people need in terms of health, and I want to have a better understanding what they need, and also to bring them into my research process. So to do that, I did my field observation. That means I observed their online conversation and online platform and see what they're really talking about, what do they really need. And after that, I did some informal interviews with some of the immigrant mothers, just to ask, what are the things you want me to study? What are some of the health needs you think it's important for you, but it's really not addressed? So through that, I was able to have a better understanding of their needs and find a way to engagement into my research process. But at the same time, I'm not one of the community, and I don't want to present myself as just a researcher to survey them, give them a survey, and take my data and leave. So to gain a better credibility, this is my harassment cascade, or I call it the millennial way for community engagement. So what I did, I capitalized on really prevalent online social media use among this population. And by that, I mean I created an online platform to disseminate evidence-based maternal child-related public health information. And apologize for the language barrier, but this is just to show you what are the articles I've written. So I wrote about common skin issues on infants. Like this one is about article on colic, because the mothers talk about this a lot. And the article over there is the third one below is postpartum depression, and there's one in response to the tick outbreak last year in Wisconsin, and that really scared the moms. So I created an article talking about what this is really about and how do you get rid of the tick and things like that. And then there's one on use of sunscreen, and I'm just gonna show you quickly how it looked like. And actually gave me a really good opportunity to learn how to present language that it's accessible and understandable by the population. So apologies for the language barrier again. And you can see that when you click open, you'll see my photo. I know it's not a best public health message, but we're in Wisconsin, right? And so what I have is and there's some news inserted. Like the sunscreen we use right now is still from the 90s. And I'll show them what are the things on sunscreen, what are those mean. And I use a lot of graphics and try to use some humor to have them engage and continue reading. So, and then I'll tell them who needs to use the sunscreen, what about a baby under 6 months. And there's more reading if they want to read more about it. And there are just some personal link to YouTube video, how to use sunscreen, how much you need, and things like that. So that's just to give you an idea what are the things I've done. And so through this community engagement process, and also by doing a literature review, what I found is that this group of people really have little awareness what is postpartum depression and what does it mean and how to screen for it. And when I interviewed them, most of them actually have not been screened at all. So I was curious, how this happened, and that led to my survey study to explore their postpartum depression screening experiences and how they think about screening for postpartum depression. And because there's no survey with relevant and culturally linguistically appropriate content, what I have done is I developed a survey working together with our own faculty member here, Dr. Diane Lawver. And then we pre-tested the survey by using content validity testing, so asking the content expert opinion, and also we did a cognitive interview with immigrant mothers to look at how they think about the survey. Is there anything that they think it's difficult to understand? So after that, we disseminated a survey online using the same social media platform. And I want to mention that, so the lady on the left, she is also once our badge nurse as a visiting scholar from China, and she has been a wonderful colleague, and she has been a very important gatekeeper for my research population. And also I worked with the Office of Child Care and Family Resources and the University Housing for this study. So through this study, especially through the cognitive interview with immigrant mothers, I learned that the existing clinical screening tools, such as the postpartum depression screening, Edinburgh postpartum depression screening scale, and also the existing postpartum depression theory that was developed with mostly middle-class white American mothers, doesn't really capture the experience of immigrant mothers' postpartum depression. And we don't really know how do they respond to the postpartum depression, how's that process look like. So that led to my dissertation study focusing on immigrant mothers' postpartum depression experience and their social psychological responses. And the study also have a second aim, which is to see how the existing theory can, or how much it can explain the experience of this population. And I use one of the qualitative methods, grounded theory, to conduct my dissertation study. So some of the major findings I have is that the most central problem I see is a loss of self. And the central processes is to negotiate a new self. And this all happened in a context of dual transitioning social world, meaning from native to foreign and from woman to mother. So this is like two parallel processes they have to deal with daily life. In addition, I've found that the relationship with husband, also with mother-in-law, is a very important condition for distress and depression. And also, in turn, the distress, a source of distress, and how they respond to distress have a really big impact on the relationship with the mother's relationship with themselves and with their family, in addition to engagement with children and development of parenting skill. So I found my research trajectory very fruitful, not because it is very rewarding for me, but also it's very therapeutic for my participants. So I just use this quote to show why I'm saying this. So this participant said, the interview session has been very therapeutic for me. I've been too embedded in my own stories to see them as outsider. I barely have any chance to think about myself and reflect on my experiences. And the questions you asked me were helpful. I'm happy I can share my experiences and someone listened. So in terms of my future studies, I wanted to focus on a wider immigrant group, like Latina mother who also experienced the dual transitioning process. And also I wanted to explore the father's perspective when mother is responding to the distress, because I've discovered that a relationship with husband is such an important factor. And so with this study, what I hope to do in the future is to develop culturally tailored maternal mental health intervention with the end goal to improve mental health of new mothers, young children, and their families. And I also wanted to plug in a few points of scholarship in teaching because this has been a very important aspect of my research training and my goal to become nursing faculty in the future. And I wanted to highlight that the school's Nurse Educator program as a response to the faculty shortage we have right now. And I also wanted to acknowledge the support, the financial support for the teaching assistantship, research assistantship, and project assistantship for graduate students that really give us more time to focus on what we need to do instead of worrying about financial security. So when I was a teaching assistant in the only mental health class in the undergrad curriculum, we developed a mental health simulation in response to a lack of mental health clinical. So what we have done is ask the student to develop and simulate and evaluate their own experiences and their peers' experience during the simulation. And well, you can see that we've used the C10 C10's lab, especially the home apartment lab to carry out this simulation. So you can see the students are in the lab waiting for the nurse to come in. And there's an example poster that the student have developed. And on the right is the student going around doing their poster fair to evaluate themselves and each other's poster. So that's our teaching team. It's also an example of a PhD and DNP student collaboration. So the teaching team includes our own faculty, Dr. Oakley, DNP student Katie Stahl, and myself. So what we discovered is that the simulation is effective. The student will be able to identify distress and respond to distress. So although there are various levels of learning, we do feel really rewarded that the student be able to address the learning outcome. So I'm using these three quotes to show you the highest level of learning in this class. So the first student said, although it's a physiological health concern, I learned how it can impact the client psychologically as well. And the second student said, the most important thing to do is treat the patient, not the illness. And the third student said, when working with the patients that are difficult and you do not know what to say, listening will make all the difference. Yeah, so let's sum it up for my presentation. And I just wanted to contribute to, give a shout out to all my colleagues who are all stellar scholars in this program. And we really appreciate the support that the donors give us to proceed in our program, thrive in our program. And also wanted to, even Bob is not here, just a shout out to my mentor, Bob Bowers, and that really shows how important the mentorship is in our program and how important it is to have the mentorship early on. And also I wanted to thank the Board of Visitors for having me for 2 years, and it has been a really wonderful learning experience, and I just so grateful. Yeah. Thank you.